Okay, great. Delighted to be here in Dana Point again, and I'm here to speak for Mirai Medical. My name is Declan Soden, CEO and founder, and Mirai has been pioneering really the use of a technology called pulsed electric fields to essentially selectively ablate cancer cells. So this technology is very exciting. It allows us to treat cancer without causing catastrophic destruction to surrounding healthy tissue structures. And we've seen a lot of excitement with pulsed electric fields in terms of use for pulse field ablation, particularly in the cardiac space over the last number of years. And really what's driving adoption, aggressive adoption of the technology in that area is this kind of superior safety of this approach in terms of ablation. So it's kind of replacing the older thermal ablation modalities. So our focus as a company is in using pulsed electric fields in the gastrointestinal tract and hopefully helping patients with cancer kind of overcome some of their symptoms. So, kind of talking about that, the clinical challenge or the unmet clinical need that we as a company are focused on addressing, really it's around the patients with later stage GI cancer. And so, we're talking about, for patients with esophageal cancer, half of patients will be palliative at diagnosis, so there is no curative option for them. And similarly, for patients with lower GI colorectal cancer, approximately 25% of all patients will be kind of palliative, so kind of the options, the treatment options available to them are relatively kind of limited. Obviously, I'm sure all of us here in the room are familiar with that kind of situation or scenario. We've got palliative chemotherapy, radiation treatment to help kind of manage the symptoms. But they all come with significant drawbacks and side effects as well for the patient. And the kind of final option really, particularly or specifically for upper GI, is around stenting. So, as the tumor progresses, the lumen closes, it becomes obstructed. So patients can't swallow or patients can't pass bowel movements, and that presents very serious quality of life issues. And so stenting then is considered as a kind of final step to try and kind of keep the lumen itself open so the patient can have a normal quality of life. But it comes with pain, it comes with discomfort, and clearly you're obviously not treating the disease, you're just trying to manage the symptoms for the patient. So this is our solution using pulse electric fields. We have the ePore generator that we've developed to deliver these high frequency biphasic pulses directly into the tumor tissue. It's a very simple generator, kind of point and press the button. This is the Indovi device on the left-hand side, so it's an over-the-scope device, a first-generation device. We have second-generation devices being developed that go through the working channel of the scope themselves. So the device is kind of maneuvered in here. Actually, the other video kind of went ahead, but it kind of attaches onto the tumor tissue, and we apply a vacuum to grip the area, and then the electrical pulses are delivered through the generator into that tissue. So we kind of treat a relatively large volume, and then it's repositioned and placed multiple times depending on the overall size and shape of the tumor. And so there's a kind of second video here as well, actually showing that application itself. And apologies, I probably should have warned you, yes, some pretty awesome pictures here, but this is the impact on a patient. So, we're in the clinic, we're treating patients, we've completed 6 clinical studies, we've treated over 250 patients at this stage in Europe, so we're not on the market in the US just yet. And so this is a patient, an 80-year-old patient with colorectal cancer with an obstructive disease, as you can see here on the left and in the middle. So this prevents the patient from having a proper bowel movement. So that's constipation, that's pain, that's discomfort. And the secondary side of things here as well is that the tumor itself is bleeding, so the patient has some degree of blood loss, which affects a significant number of patients with GI malignancies. And it gets worse as the disease progresses. So this case would have been treated similar to the video you saw on the last slide, treated in a matter of minutes, the energy delivered, and you can see the follow-up at 6 weeks. And obviously the pictures really kind of speak for themselves, but the impact this has on a patient's quality of life. Now you're able to have proper bowel movements, you're able to have a normal function and quality of life, which is what you want as an 80-year-old. You don't want to be spending weeks in hospital, you don't want to be suffering the side effects of chemotherapy and radiation treatment. If you can have a simple 30-minute endoscopy outpatient treatment to relieve your symptoms, well then that's a big win and that's worth it. So we've done this. We have completed 5 clinical studies in patients with late-stage GI cancer. So these are patients with esophageal or colorectal cancer. We've been able to demonstrate, really importantly, safety. That's obviously a key priority here with the new technology. We're the first company in the world to deliver pulsed electric fields in the GI tract. And so clearly, you need to build confidence around how safe is this. So we've had no serious adverse events associated with applying this. We've been able to demonstrate we can deliver it as an outpatient solution. And then clearly we've been able to demonstrate improved quality of life for patients, so pain relief. And also importantly, bleeding cessation is actually an important criteria as well in terms of as a complication, as a problem to treat. We've also completed a study, and which was published in the last couple of months in collaboration with the University of Copenhagen, of treating patients prior to surgery. So this is kind of moving forward then from palliation to perhaps using this as a bridge to surgery. And really the focus of that study was looking at, in a 21-patient study, was can we offer this treatment prior to surgery? Does it interfere with the ability to subsequently do surgery? And really interesting is the kind of immune engagement question as well. Can we help to prime the tumor to be more responsive to immunotherapy? So there's a lot of research ongoing right now in our company looking at that. So we were fortunate to get a €7.5 million non-dilutive research grant in the recent history to look and explore that particular area as well. And some pretty exciting data to suggest that treating the tumor in situ and ablating it and opening it up to the patient's immune system can help to improve the patient's immune system's responsiveness to subsequent immunotherapy as well. And then finally, we're also then treating patients in a pilot, or have treated patients in a pilot clinical study with early stage colorectal cancer, so pre-malignant complex polyps as well, which has gone really well. And this is an example of one of the patients in that study. So patients have colonoscopies. About 10% of patients will have a complex polyp. So a polyp that can't be removed with a simple snare. These are cases that will be referred and sent to an endoscopic specialist or a surgeon to be removed. And so these kind of endoscopic procedures typically take maybe 45 minutes to an hour. It depends on the expertise of the endoscopist doing the procedure. In this particular case, you can see the bleeding polyp on the left-hand side. It was treated in under 5 minutes. You can see the bleeding stops immediately, so that's an effect of these pulsed electric fields. It causes the capillaries to shrink, and you can see the follow-up at 4 weeks. And what's really exciting is that when you take biopsies in that area, you're just seeing healthy mucosa. So the adenoma is gone in a treatment that took a few minutes to deliver. So this opens the door to democratizing endoscopy, and hopefully at some point in the future for cases like this to be treated at the same time as a colonoscopy. So again, over 250 cases done. We have a real-world registry in Europe ongoing, collecting data from those cases. Again, no safety issues in terms of serious adverse events associated with the technology. And then we have a pilot commercial rollout ongoing at King's College London, and we anticipate over 45 paid-for commercial procedures to be conducted there this year, which obviously is really critical, isn't it? It's just not just exciting technology. People are willing, or hospitals willing to pay for the procedure to treat their patients on an increasing basis over the last 12 months. So it's a platform. Very excited about what we have and how we deliver pulsed electric fields. We're open to collaboration and partnership for other groups in terms of maybe other indications that are beyond our bandwidth to address. Obviously, our focus is on GI cancer. GI bleeding is another potential indication, and pre-malignancies also. So yeah, very open to have that discussion around potential partnerships for other areas. Very significant market opportunity, as you can imagine, as well. The GI cancer indication, so the late-stage GI cancer, treating patients with palliative esophageal or colorectal cancer, is over $1 billion market opportunity in the US alone, and globally over 2.1 million. And then obviously there's other significant indications like GI bleeding and complex polyps with the same platform, the same system that we have, that represent pretty significant market opportunities as well. And we're working towards building the clinical evidence to prove the value that our technology can offer. I'm running out of time. Strong patent portfolio, 15 patents granted. We really have some unique IP on how we deliver pulsed electric fields. Always very happy to talk about that privately. Great team. Dave Pierce, past president of Endoscopy Boston Scientific, has joined our board as well. He's a huge contributor. Sean Kinsler, our CTO, is here with us as well this week at LSI, and working with some of the leading clinicians in the major hospitals like the Mayo Clinic, Dr. Rajan, Dr. Galen Lung at Perlman, Dr. Haji, and others who are really keen to offer this technology to their patients. And so we are in the process of planning a Series A of 30 million to kick off in the coming few months to support kind of US market entry, US regulatory and clinical evidence, and really happy to have engagement with any investors or partners who really would like to talk to Mirai Medical about that this week or afterwards. Thank you very much.